2, 1, boom. Hotep Jesus.
Of all the Jesuses I know, he's the Hotepiest. Social scientist and YouTube host, Hotep Jesus.
How the fuck do you get a name like Hotep Jesus?
The one and only Hotep Jesus.
Ryan Sharp, better known to the world as Hotep Jesus.
Hotep Jesus. Hotep Jesus. Hotep Jesus.
Hotep, you're a genius. HotepJesus.com.
Somebody said, what do you think you are, some kind of Hotep Jesus?
Ooh,
and
that's
I was
good.
Just like, ooh, that's sexy. Yes, I do think I'm Hotep Jesus.
Ladies and gentlemen, welcome to a very special edition of the Griff Report. I have Dr. Micah Allen. She's a neuropathic doctor, acupuncturist, wellness thought leader, genius, mother, wife, very successful. Also my cousin. It runs in the family. It's in the blood. It's in the blood. Micah, how you doing?
I am doing very well today. Very excited to be here with you to chat and discuss.
Yes, yes. Should I call you? I feel like I gotta call you Dr. Allen. I can't call you Mike. I gotta call you Dr. Allen.
Cool. I'm cool. Whatever way works for me.
All right, let's get right into this thing. So, you had a passion in healing medicine at some point, I'm sure. But you seem to take a different path. You've taken the naturopath route instead of traditional medicine. And I'm wondering to myself, how did that happen? Why did you feel like, that was a better path for you? Why didn't you go the traditional doctor route?
Yeah, it's a really great question. Actually, the beginnings for me was vet medicine. So I was all the way on the opposite end of the spectrum. Through high school and middle school, I was for sure that was what I was going to do. Until I got to Florida A&M University in the animal science program, and they're telling us it's time to go to the farm. And I'm like, hold on now. Companion animals, small animals, I'm cool with, but we're talking about cows. And they're like, oh, we're going to process animals today. I was like, yeah, I don't think I want to do that. So I was 2 years in, and I decided to shift my focus to the pharmacy school. So I was doing my research there, and had an opportunity to do an internship with a gastroenterologist who was also a pharmacist. And I was doing rounds with him, seeing patients, as well as in the surgical suite doing endoscopies and colonoscopies or observing them. And I noticed the love for medicine and being able to help people navigate. But the structure of it all was difficult for me because the consult was maybe 5 to 7 minutes to be able to get somebody's full story. And, there were these guidelines, if you had GERD, then you got a proton pump inhibitor. If you, had constipation, you got Miralax. There was no diversity in the approach to treating the patient. But after we would do rounds, we would have conversations about nutrition and lifestyle and stress and how it impacted health. And so for me, I wanted something, that would be congruent with what I would offer to a family or a friend, and not necessarily, not have that congruency in both life and professional life. So that was what prompted me to look in a different direction. And I did my studies at Bastyr University out in the Pacific Northwest. And while there in naturopathic medical school, I found acupuncture. And so the marriage of the two have provided me an opportunity to give folks concrete, objective, and effective solutions with naturopathic medicine. But with acupuncture, we're able to move the dial a lot quicker and get people results. The chronic care can take a little while for implementation. But again, the acupuncture helps people with priming their nervous system and being able to move and get results quicker. So it's been great.
All right, I want to go back just a little bit here. You said you were dealing with, some ailments, and it seems like they were taking one approach. Did you were you alarmed that there was one approach, or did you have some insight that said, I think there is another way, or did you just assume there was another way? What was that like?
Right. And so that's what I meant. During the day, doing rounds with this provider, which he was a fantastic person. It was, I think, because of the constraints that we were under, whether it be, via insurance companies or certain ways that, folks are taught to treat or approach medicine. That's one way we showed up during the day, but the conversations that we had afterwards were like all of these other determinants of health that can possibly be impacting these folks, but we're not really given the opportunity to delve into that or make recommendations about, how stress might be creating somebody to experience, IBS. It's just like, yeah, we got 5 to 7 minutes. Here's this medication that's a part of the guidelines that I've been given. And that's what we're going to stick with. So I wanted it to be more holistic. I wanted it to, be an experience for the consumer, the healthcare consumer, to where they could actually, resolve issues instead of it being, something where you came and got a refill every 3 months, for the rest of your life. So a lot of people don't like to hear this. I tell my patients, my job really is to teach you, to empower you. So that way, when something comes up, you know how to approach it. And then if something new comes up, let's chat and talk about what you're going to need in place and how to approach that. But I kind of like work myself out of being a provider that you're going to be exclusively dependent on, because I want to teach and empower you so that you can take your own health into your hands.
Okay. So then professionally, when did you start your practice?
In 2011. So
okay.
We're going on 13 years. Yeah.
So before that, were you working for somebody else, hospital, or what was your work like?
Yeah. So right out of school, I joined a practice out in Bellevue, Washington. So, a lot of folks will know that as a home of Microsoft. But I was there, seeing patients
Naturopath?
with another provider. Yes. She was also a naturopathic physician and licensed acupuncturist. So we were both considered dual licensed. And so I worked with her for about a year and a half. And then I continued to work with her after my second child was born. But then I, created a space for myself and eventually branched out on my own after about year 2 in practice.
Okay. Dope. That's awesome. Good stuff. So now, we spoke to somebody at the family reunion.
Yeah.
Just, a little segue. People tried to say my family was bougie and boule. Could you please tell them our family is the complete opposite of that?
So I will say that we span the spectrum of all of the above as it relates to how, folks present. So we have some bougie folks, and we have some folks who are down to earth, just like I think every family does, right? So we're not all the same. We all have different thought processes, which makes it that much more beautiful, right? When we're able to come together and have discussion and be able to agree, sometimes to disagree. But yeah.
You so damn professional. It's not the answer I was looking for.
Well, I mean, is it not true?
It's true.
All right.
It's true. So you're dealing with, we spoke at the family union about some of your clients, and we mentioned, you deal in fertility.
Yeah.
What is some of the problems that you're seeing with people and why they're having issues with fertility?
Yeah, it's becoming a huge issue. Say 10 to 15% of couples in the United States battle with some form of infertility. And infertility is, when a couple is actively trying for up to 12 months to fall pregnant. I'm noticing stress is a huge factor. It's definitely multifactorial. I think a lot of times folks don't consider male factor infertility. I'm seeing a lot more of that these days as well. And then as it relates to metabolic syndrome or insulin resistance, and that has a lot to do with, dietary choices, lifestyle choices. But yeah, it can, think again with infertility, it can be a number of so many different factors. That's why it's so important, especially for it to be a holistic approach and not just, take this pill or do this, because it can stem from so many different presentations.
So you said you're seeing it more with the men,
Well, I think what's happened
or
is
is it an increase?
there's an increase in as far as sperm quality being affected, sperm count being affected. We're thinking, like I said, lifestyle, diet choices, stress, but also electromagnetic fields. We haven't, necessarily delved into how that could be an issue. But again, there's so many different ways that fertility can be affected. I think what's happened is men hasn't necessarily been included in this process before. It's mostly been, what's going on with the woman? Why can't she get pregnant? But now we're taking a look at both parties and starting to see where, at least in my practice, I'm seeing a lot of male factor infertility. And it usually comes about after we've worked with the wife or, the woman partner for a bit, and everything is golden, everything looks great there. And I would always ask beforehand, has your husband or partner had a sperm analysis? And it's typically like, yep, he's had that and it looked fantastic, it looked great. And then after 2 or 3 months, I'm like, okay, you are passing with green lights. We're all set and ready to go as far as you're concerned. Let's do another sperm analysis on your partner. And then, we're seeing changes as far as DNA fragmentation, seeing changes in the shape of the sperm, double tails, double heads. And that obviously means, that means that there's going to be some issues with not just the person falling pregnant, but also maintaining the pregnancy because the DNA is damaged.
Damn.
I know.
Is this new?
It's not new.
Okay.
No.
Okay. All right.
No, but the great thing is that if you're able to find the information about there being issues, whether it be sperm count or morphology, speed, there's so many different factors that go into, the quality of both the egg and the sperm. The great thing is that you are able to approach it to help with increasing the quality of said sperm or egg. So I work a lot with preconception care, working with couples to be able to get them healthy, not just their whole cells, but also obviously the egg and the sperm. Therefore, we, are increasing the likelihood of them falling pregnant and staying pregnant. So
let's get spicy.
Yeah.
These white folks, black folks, Asian folks, are you seeing disparities in race, or does it not matter?
All of the above. I think what I would say, when it comes to female infertility, a lot of times in the African American community, because of access to care, there can be, issues, because I also see a lot of what's called quote unquote unexplained infertility. And so say, for instance, if someone hasn't had access to, annual exams until, they've finally become, in the middle to upper class and they can finally afford insurance and get those annual exams every year, but they may have had, endometriosis, or they may have had PCOS, something that was undiagnosed and had not been treated for a long period of time. So I think those are the issues that I see a lot with my African American clients, or, if they had painful periods their whole lives and been dismissed and said, okay, yeah, no, there's this implicit bias that, African Americans in general are going to tolerate more pain, and therefore it's not investigated. So there can be, a wide variety of reasons why someone ends up in that basket of unexplained infertility. Folks can decide that they want to pursue their career or professional lives and, wait until their mid to late 40s to start, trying to have a family. So it can be a host of different things, but I am seeing it across all, all walks of life.
All races are dealing with this issue.
Absolutely.
But in different ways, like would you say there's some uniqueness to the issues in the black community and some uniqueness with the, Asian community or the white community, or is it all pretty much the same stuff?
The way that I approach it, I see it all the same, because every person is going to be different. They're going to have their own set of, circumstances that they've, that's led up to them coming to my office. So I wouldn't say that it's black and white or red and yellow based off of race. Yeah. So I just look at the person when they come in and we sort through it.
The reason why I asked that is because I know that in the African American community, we have a lot of women specifically suffering from things like lupus, right? So that seems to be unique to black women, right? Not to say that white women don't get it, but it seems like it's plaguing our community right now.
Yeah. And autoimmune disease in general, when we think about just epigenetics and history and autoimmune diseases basically is your body, fighting against itself. So there's definitely a lot of, I would say, larger propensity of autoimmune disease just in women in general, but most certainly, African American women as it relates to lupus.
Okay, let's keep staying. We're gonna stay spicy. How much this infertility, two-headed sperms and two-tailed sperms can we attribute it to the pandemic and the pandemic treatments?
Got it. I would say I haven't necessarily seen any direct correlations as far as fertility is concerned, because the decline in sperm quality and the decline in sperm count has been, declining even before, COVID-19. So it isn't a drastic drop or drastic, dramatic change as far as fertility is concerned. Again, based off of what I've seen in practice. I have seen some other things that have increased pretty significantly during that time that I wasn't seeing a lot of beforehand. But I would say
what'd you see?
So lots of like neurological presentations, trigeminal neuralgia. So that's like, a nerve that is facial nerve. So lots of folks having like TMJ or facial paralysis, lots of dermatological presentations like psoriasis, again, autoimmune, long COVID as far as like brain fog, fatigue, fibromyalgia. My office stayed open the entire time during COVID. So we were able to see, folks pre-COVID, during, vaccination rollout, afterward. So it's just been really interesting to observe how folks have responded and just, how people are dealing with it. So we see a lot of folks too with long COVID to help support them, some cardiovascular diseases. But the biggest thing that I think has been different that is really, difficult for me is being able to see a stark increase in younger folks. I'm talking between the ages of 20 to 40 years old who are being diagnosed with stage 3 and stage 4 cancers. So that, for me as a provider who isn't necessarily in the business of palliative care, having to get used to, hearing stories of people who are similar age to you, who have young kids, kind of at the same phase of life as yourself, who are facing terminal illnesses has been quite difficult. So, yeah.
Damn. Okay. So how did you deal with the pandemic? Did you have treatment? Did you have methodologies? Did you have lifestyle changes? How did you deal with it yourself, your patients, etc.? What suggestions were you making? Were you giving them, horse dewormer or what? Well, how did you deal with that?
Yeah, it's a great question. For me, vaccines have always been a personal preference. I always, try my best to educate patients on both the pros and the cons. At the end of the day, it's completely up to that person to decide, what they or how they want to move forward with it. So that's the same way that I approach COVID-19 as well. Like I said, we were open throughout the entire time. So we were there to help support folks, whether it was, healthcare providers who were essential workers providing care. So we were treating a lot of folks for anxiety and depression and burnout, whether it was, on the patient forefront, where it's, pneumonia or cardiovascular disease or, diabetes, metabolic syndrome. So we were just there and showing up to help support people wherever they were, and helping to be that guide, like what we talked about earlier. So for me, it's all about, the person coming, sharing their story, seeing where they need the most help, and then being able to help guide them along the way so that they can get the result that they're looking for ultimately. So yeah, that's my approach.
Did you prescribe any medicines or herbs, or what was your approach to COVID? If somebody came to you and say, "Hey, I think I got COVID," they tested positive. What would you suggest they do?
Yeah, so I, as a naturopathic doctor in the state of Virginia, so I'm in a pre-licensed state. In Washington State, where I hold my license, obviously medication prescription is available to me. So in a pre-licensed state as a naturopathic doctor, it was mostly complementary care. And so for me, it's going to be, supporting the immune system with micronutrients like vitamin A, C, E, and zinc and selenium. We're going to be working on cellular support. So always looking at the mitochondria. So if you got CoQ10 or ubiquinol, we want to be able to make sure that we're supporting the mitochondria, because those guys are going to be fueling each of our individual cells. And so because, again, blood sugar and cardiovascular health was impacted so roughly with COVID-19, always talking about dietary and lifestyle changes. So making sure folks were moving at least 30 to 45 minutes a day. Was a lot of, isolation and loneliness. And so encouraging folks, to get outside, even though we were all, wanting to be considered, separating ourselves from one another. But, if you had your hub or you had your small community in your neighborhood, still making sure to connect, because all of those things were really important, not just for, social aspects, but also for immune system and for cardiovascular health. So it was like a litany of different things that I would say during that time that I would recommend. And then obviously if folks had their own personal, ailment or issue, we would delve into that as well. But my approach is really personalized, so it's really hard to make general recommendations. But I would say those would be some of the basics.
Now, here's the thing, the history of Black folks and the medical industry is a bit gory. It's a bit inhumane. And so I don't trust hospitals. I don't trust them at all. If something happened to me, I'm going to be calling you and Rook up. You know what I mean? Hey, man, I'm messed up out here. Help me out. I probably wouldn't want to go to the hospital. And one of the things I saw that I thought the hospital was doing wrong, and you could tell me if I'm off base here, but they're putting people on those respirators. And I thought, respirators are usually for people that are on their last breath, and, the family just going to come see them and whatever. How do you view that whole respiratory and putting people on that respirator? Do you agree with that, what I said, or is there some nuance here?
I think because COVID-19, what happened, how it happened, everybody was just trying to sort through it as it occurred, quite honestly. And so there was a lot of shifting, adjusting. Hey, we talk about medicine, practicing medicine. Every time that we interface, or as providers, I know it sounds really weird, but we're practicing medicine. Like we're trying to figure it out. And so I think a lot of what happened was just trying to figure out what was going to be best for the outcome of the patient. And some of that, did it end up being not the greatest options or not the greatest possible intervention? Yes, that's what happens in practice, right? You figure some stuff out and it works fantastic, and then other things not so much. So I'm never going to be on the end of hitting conventional and complementary medicine, opposite ends of the spectrum. For me, it's about being able to work together, come together for the good of the patient, because at the end of the day, their outcome, making it the most positive experience, is always going to be my goal. So I do partner a lot with providers, whether it be, hematologists or PCPs or derm or chiros, because I think it's important for everybody to have a seat at the table in order, again, like I said, to move the patient's health forward. So
I'm gonna stay in the same lane of keeping my foot on the hospital neck. Again, you could tell me if I'm off base here, but
yeah.
Why are women delivering babies horizontal? Don't it make sense to have them deliver the baby where it flows with gravity, or am I just stupid?
No, that's absolutely spot on.
Okay.
Yeah, that I think a lot of what has happened in birthing, and we do have some partners just down the way from us here in Midlothian, the only freestanding Black midwifery home. Well, she's not home birth; she has a birth center here in Central Virginia, and so we're huge proponents of doulas and huge proponents of home birth. If the client is a great candidate for it, obviously there are some things, if there's high risk, in hospital is going to be preferred. But yes, like get a telemetry pack, allow that mom to be able to walk around.
Who?
Telemetry. It's like, so, when you go into the hospital and you have to get an IV.
Yeah.
And so a lot of times if the patient has an IV, that means they have a pole,
Right.
and they have to stay confined to the bed.
Mhm.
They can't walk around, they can't move, they can't sit up like you're, suggesting, as far as to be able to push and be in a different position than just horizontal. And so, just basic things like having a doula, a telemetry pack is still an IV, but it allows you to be able to move and not be confined to one space. And so I think as we integrate more birth workers, even if the person has to be in a hospital, so that, again, patients are empowered, they know what to ask for, they have someone there who can advocate on their behalf, depending on what they decided before that birth that they wanted in a birth plan. I think that's where we need to move just as a society, because birth has most certainly been medicalized for way too long. It is a natural process, one that we should observe. But like I said before, if there are some high risk tendencies, then the observation may be a little bit more intent. But yeah, for the most part, I'm all about being able to move, being able to eat, and be in a position to be able to bring life into Earthside.
I want to talk about that process of birth, but first, I want to test your history knowledge. And
History, not science all day. We'll see how this goes.
The internet makes up a lot of rumors. They said, it was some King George that told women they gotta be, horizontal. Where did that horizontal bed thing come from? Do you know where that started at and why they decided to lay a woman horizontal? Or do you not sure?
So I know that the origins of gynecology is, originates from white males, right?
Okay.
And convenience as well. Like, what's going to be easiest for me, right?
The doctor.
Right.
Okay.
And so again, it makes absolutely no sense. But if I'm going to be able to control what's happening, how this is happening, like I can't have you up and walking around. If we look at traditional midwifery, then, we can see, again, this kind of non-medicalized, but more of a natural occurrence happening. So history-wise, I can't tell you the name of the person or where it started, but
Right.
I know the origins of gynecology is white males. Yeah.
Okay. It's the white man. Let's talk about the process of childbirth, right? So you have the horizontal childbirth, and you have the epidural, right? And then you have the what's the sac that comes out with the baby?
The amniotic sac.
Amniotic sac, right? You got that situation. You got the umbilical cord. Now, Western med is horizontal, cut umbilical cord, right? And from, my little bit of Hotep lessons, it's in the bathtub, natural, keep the amniotic sac and the placenta, that's what I was looking for, right? The placenta. Keep the placenta attached to the baby, umbilical cord attached to the baby, because if you don't keep it attached for a certain period of time, the certain stem cells are not getting a baby. Is this fake news, or am I on point here, or what?
No, it's not fake news. Yeah. So the placenta pulsing after birth is, definitely warranted and recommended if possible. But again, I think if you're in hospital, you can actually ask, right? You can ask. I think this is what has been disconnected, is that for so long, folks have, completely allowed all of their processes to just be, basically ushered in by the provider. But knowing that you have a say-so in what happens during your process, I don't think people understand that they have had that opportunity, because it wasn't something that was known. So if you decide that you want to allow your placenta to remain intact and not cut it, soon after, have that be a part of the birth plan and say, hey, this is what I want. And this is, something that I want to be respected and something to take place. And so it's a possibility to have that, even if you are in hospital. But doing your research, if you have the opportunity to find a doctor who's going to, have the same or similar values to you, having the same or similar values as far as a hospital that you decide to give birth in, all of those things are going to be really important. So my first was an emergency C-section. My midwife ended up being my doula, but obviously I was educated enough. But when it comes to birth, we've seen it in the news as well. It doesn't matter as far as your education level, your level as far as like monetary or financial success. You can still fall prey to, medical situations that don't serve you or aren't in your best interest. And so having a doula, having somebody there who knows what you want, even if you aren't able to communicate that yourself, for whatever reason, is going to be really important. So that placenta pulsing, all of that is definitely doable, and I highly recommend it.
So the placenta post-birth is pulsing. How long should we keep that attached?
Yeah, it depends on, your preferences.
Mhm.
For me, for my second one, because again, I found, because I had the first C-section, so I was considered, they're like, oh, you had one C-section, you got to have another one. I said, no, I'm interested in a vaginal birth after cesarean. So we found a hospital that was, open to having women remain pregnant until, after 42 weeks. Typically, if you're at 40 weeks, they're like, nope, we got to cut. And then I found a certified nurse midwife, again, who aligned with my thoughts and my wishes as well. And so for my daughter, it was, right at about, I think it was like 3 to 5 minutes, somewhere along that line, before we cut her umbilical cord. And she actually was born inside of her amniotic sac. So my water never broke with her, which was really cool. And so she was still enclosed after birth, and it ended up being a vaginal birth. But yeah, so.
Oh, wow.
Yeah, it was pretty spectacular.
Oh, wow. That's kind of cool. Okay. So what are we talking about here? Because, when I think about birth, I think of color purple, screaming and yelling and, intense pain, right? Like, is that real when you do it natural? Do you give them, some medicine for the pain or anything like that?
Yeah, and I by no way am a midwife or an OB, but my personal experience, like I said, having had a C-section, having supported women who, are birthing, is, it's all dependent. Some people can, muster through some pain. There's hypnobirthing. There's, breathing techniques that can be helpful. There's acupressure points that you can, ensue. You talked about water birthing. So all of those different resources are available to help mitigate the pain, but it's still painful. It's still painful.
It is. Okay. All right. All right. I thought it might have been, some ancient drug or some ancient, marijuana or something you could give her and she don't feel no pain, I study history. So, in history, I've heard about, things that were happening to the island people when the Spanish met them, and, they had certain ways. And it was kind of like what you said, like a little bit of hypnosis was going on there. So they would hallucinate. Yeah. So I think that's the type of medicines they were giving them. Let's talk about acupuncture, because you mentioned acupuncture. What do you use acupuncture for?
Oh man, so acupuncture is a part of a whole system of medicine, traditional Chinese medicine.
Mm-hmm.
So it's just one part of it, but because it is a system, we can most certainly apply it to most presentations. Something acute, you broke your leg, do not come to me for acupuncture. Not in that moment. Post-surgery, recovery, absolutely. We can get you back to feeling fantastic a lot quicker. And so I would say chronic presentations, but I mean, anxiety, high blood pressure, insomnia, reproductive hormone balancing, sky's the limit with acupuncture.
Hold on, I'm texting somebody who knows this stuff way better than I do. I said, what should I ask her? Let's see what kind of response I get, from the professionals, to get some professionals. Rook, check your phone. I need your help here, because you know exactly what to ask her. So the acupuncture, can you treat diabetes with acupuncture?
Yeah, it's really cool because acupuncture is helping basically at a nervous system level, realign your nervous system. And so we see a lot with diabetes, where cortisol, which is that stress hormone that the adrenal glands produce, folks who are under high stress, right? And with that high stress and increased cortisol production, that's going to increase our body's production of glucose, sugar.
Okay.
And so, because again, when you're in a fight or flight mode, your body needs a source of fuel, and glucose is the main fuel source for our cells, right?
Okay.
So, you don't want to be staring down the barrel of, say, like a gun, or running away from a bear, and your body doesn't have enough glucose or fuel to supply your muscles, your brain, your heart, and your lungs, right? So we're in these like hypersympathetic states, but we're not in imminent danger just because of the stressors of everyday life. And so that causes increased amount of blood sugar or glucose in the bloodstream, which then creates this whole dynamic of high blood sugar, diabetes, the list goes on and on. What acupuncture does is it moves you out of that sympathetic state into the parasympathetic state, which is that state where you feel grounded and centered, you're resting and digesting appropriately. And so that's if we want to, see how to correlate acupuncture with being able to be helpful for blood sugar, diabetes, again, that's going to be the way, because we're moving you out of that fight or flight into the rest and digest.
So it sounds to me like the nervous system is the electrical grid of the body, right? And, you seem to be an expert in this. So by tapping into this electrical grid, we can relieve things like stress, is what you're saying?
Yeah. And I'd like to tell my patients, obviously, I cannot eliminate the stressors that you come into contact with.
Right.
But what we do by having a series of acupuncture treatments is helping you become more resilient. So when those stressors come up, your body isn't going to shoot all the way to the opposite end of, oh my gosh, there's a bear, there's a gun, I need to produce, this adrenal hormone or cortisol. You'll still get to do what needs to be done, but it won't be as severe as far as the intensity of the response, at least internally.
Interesting. Because, we talked about diabetes, and I thought you would talk about diet, and you went straight to stress.
Well, see, again, it's multifactorial. So there are lifestyle choices, but do I have folks in my clinic who are fit and who eat fantastically well, but who may work, overnight as a provider or a nurse? who may be under, significant stress, they look fantastic from the outside. They look fit, but they still are suffering with metabolic syndrome or insulin resistance because of the high stress.
Damn, I never thought about it like that.
Mm-hmm.
Interesting. So what else can you treat with acupuncture?
Like I said, I will say, trying to think about, so fertility, because again, if the whole piece around the stress factor producing cortisol, oh, this is a good one. We basically, the same precursor that we're using to make cortisol or adrenal hormone is the same precursor that we use to make estrogen, testosterone, and progesterone. So if you're under substantial amounts of stress, and that precursor, by the way, is cholesterol, the cholesterol base is going to be shifted to create cortisol, and we're going to have a deficiency or a lack of enough testosterone, progesterone, and estrogen, right? So then we can fall into reproductive hormone imbalances or fertility issues, or issues with bone density because we don't have enough estrogen present, or libido, all those things.
Wow, interesting. Now, what about acupuncture and the endocrine gland system? I know the endocrine gland system is absolutely vital to our health.
Right.
Do you make those connections as well?
Yeah, so the adrenal gland is a part of the endocrine system. The pancreas is a part of the endocrine system. And so again, all of those things, being able to balance the nervous system is going to be helpful overall for the endocrine system. Yeah.
Sweet.
So that's the thyroid and.
Sure. Okay, so Project Rook, help me out. I got to connect y'all too. What she wants to know is about birth control. Birth control and how that's affecting fertility in women.
Absolutely. Birth control, obviously it has its place. There's so many different ways that women can, make a choice as far as birth control is concerned. But if we're speaking to oral contraceptives, which is probably one of the more common ways, those have been shown to deplete B vitamins. Those have been shown to deplete iron and ferritin. So sometimes now you'll see them paired with iron. Again, if you're doing just progesterone only, that can cause issues with weight gain. And obviously weight gain, if you have more adipocytes, that's going to be producing, issues around insulin resistance. And so it definitely has some cons associated with it. Like I said, there are lots of different routes that one can take if they decide to use, a calendar method, or if they want to use an intrauterine device, an IUD. You can either do something that's non-hormonal or hormonal based. Again, it's going to be a personal preference, but one conversation that I think is just really important for women to have is, how is this, or how can this potentially affect my fertility long term, before they decide on, what particular option they decide to go with. So
would you recommend it to one of your family members?
Would I recommend what?
Forms of birth control. If they said, hey, I want some birth control, would you recommend any?
Again, it's going to be up to what the person needs at that time. Yes. So, because you have to think about it too, falling pregnant for someone who is not ready for that can be a huge issue as well. So, if, say, for instance, I have, a family member who is considering birth control, and she has heavier periods, right? And she's like, I don't want to do oral contraceptives. I probably would not recommend for her to do a copper IUD, even though she's like, I don't want any hormones, mainly because a copper IUD is going to be great as far as birth control is concerned, but it more than likely is going to cause her to have heavier cycles. So she's going to bleed more, which in turn can cause more of an issue. So when I say like personalized care, it really is like
down to the individual.
Depending on where that person is, what their objective is, and just how they navigate in life. So yeah.
Can we I don't know how to ask this question because I'm not medically smart.
No, you're good. Ask it.
Sickle cell anemia.
Mm-hmm.
Can we eliminate that from somebody's life?
I think the correct answer would be we can make it manageable.
Okay.
Because it is, again, at a cellular level and it is genetic.
Mm-hmm.
So for me, there's always, the genetic picture, and there is the environmental or lifestyle choices, right?
Mm-hmm.
So you can still have something that is kind of like your blueprint, a part of your makeup. So it's still there, but how do we reduce the symptom presentation, right?
Okay.
Yeah, so that's what I would say for sickle cell anemia.
Crohn's, the same thing?
Crohn's, yes. So it's there, but symptom presentation, you can create a complete overhaul. Now it's going to take a lot of work because you're going to have to focus on, again, all of those different determinants of health that we talked about. Clean water, fantastic diet, making sure the microbiome is robust. We're getting probiotics and prebiotics.
You said microbiome.
Yeah.
The stuff in your gut.
Yes.
Okay.
Those are the real bosses.
Why you say that?
Because we have so much of our hormones, so much of our neurotransmitters are produced in the gut.
Neurotransmitters produced in the gut. So basically what you're saying is if you have good gut health, you tend to have better overall health.
Absolutely. When people talk about gut feelings, that's just not a misnomer.
Ladies and gentlemen, it's your opportunity to go out and get Flo to improve your gut health. Metavoted.com. You see what I did there? Metavoted.com. Last question I want to ask you here. We spoke about this at the family union. Roe v. Wade, right? Roe v. Wade was overturned. And I wanted you to just inform the people on how you think women and medical professionals could be affected by that decision.
Oh, man. There's so much to that question. I think what tends to happen, at least for me, it's always important for any person to be able to have a conversation with their medical provider and have it be an unbiased conversation. And so the provider being able to take themselves out of the conversation as far as, I'm the see all and the be all, but really taking in what the patient has to say and making the best recommendation that's going to benefit that patient, right?
Mm-hmm.
And so I think when we get into a situation where that can be skewed or there's resistance between that relationship between provider and medical consumer, then at the end of the day, the patient isn't able to get the outcome that's going to be most beneficial for them. So that's where I stand on it. I am all for whatever, because a lot of times patients will come to me and we'll do our consultation, and there might be something that comes up like a red flag for me where I feel like they need a higher intervention. We start talking about night sweats or unexplained weight loss over a certain time frame. And I'm like, yeah, I want to work on my diet. And for me, as a medical provider, I'm like, nope. Have you had your preventative screenings? Have you had a colonoscopy? Have you had an annual exam? Because again, I want to make sure the foundation of that person is intact.
Mm.
Whether or not that means that I'm a part of their story right now, or if you need to be referred to someone else, and then you can get back to me later. So
Right.
that would be my take on it, as far as Roe v. Wade is concerned.
I'm with Pac. A man, has no right to tell a woman when or where she could create a baby, right? So I'm with Pac on that. And I think there are some legal issues here, right?
Yeah.
I think there are some constitutional issues, right? Because I believe that whatever procedures a woman has should be private.
Right.
Right. So first and foremost, how did you even know I had an abortion? Right.
Right.
That's first off. Who gave you access to my records? Because that's a violation of my Fourth Amendment rights.
Right.
And then there's issues where in some states it's illegal. Right. So how does your doctor navigate that? Do you have to go to a different state, or how does that work?
So basically what happens and what we've seen happen, and that can be in relationship to what we think about as, traditional pregnancy, or, deciding to terminate a pregnancy, but even in the conversation around fertility. And so because there are embryos that are stored, sometimes there has to be, a reduction process that takes place. Then that becomes an issue as well, because, we have certain states that will deem an embryo that's in a freezer as a child. So then those folks are coming under fire, because it's like, okay, well, what do we do with these embryos that are stored, and we can't do anything. Yeah.
Wait, explain that. Wait, hold on. Wait, what? You got embryos, and where do embryos come from? The woman?
So embryos through artificial reproductive technology.
Oh, okay, I got you.
So if someone is going through IVF,
Yeah.
they go through a process of egg retrieval, and then those eggs are then inseminated, and then
Okay.
embryos are a result of that.
Okay.
Now, some families who have, a number of embryos that are stored, for them to come back and do, say, like a frozen embryo transfer. And back in the day, remember, we've seen women who were, who had embryo transfers of 6 to 7 to 8 kids, and they would have, multiples. That isn't necessarily the case, or it's not very commonly done these days, because we've seen negative effects with, multiple pregnancy births. So now what can happen is you can have a family that has embryos that are stored,
Mm-hmm.
and they do, 1 or 2 transfers, and they are successful, and they have 2 kids, but they might have 4 to 6 embryos that are stored.
Oh, so if you discard those, oh,
Yes. So in those states where, you have those new laws in place, those folks are also,
Oh, no.
fearful. They're afraid that there could be retribution if those embryos are discarded, and they're in one of those states.
Oh, okay, that makes sense. Okay, yeah, that's kind of wild.
Yeah.
That's kind of weird. When does the life begin? What is your take on that?
Oh boy.
I don't know. According to so I go spiritual studies. According to my spiritual studies, it's at the baby's first breath.
Yeah.
But I don't know. Like, I don't know. Some people say the baby's moving around and is conscious in the womb, and
Right.
I don't
That's
know.
a really hard question.
Right.
I don't know how to answer that.
Yeah.
Yeah.
It's a tough question. And everybody's got their own opinions. So I don't know. We got to bring you back. I got some more questions. I got some more topics. We got to bring you back. Dr. Micah Allen, y'all. Her link is in the description box below. If you're in the VA area, Richmond VA area specifically, hit her up. Get some elite medical care.
Yes.
You got a book out too, right? A couple of books.
No books out.
You got something on PayHip. What are those?
Yeah, those are downloads, just ebooks.
Right. Ebooks. Okay.
Yeah.
Yeah.
Yeah. Couple
Right.
ebooks, no books coming. I'm sure it's coming in the future. I got to slow down enough to be able to write some books. I saw yours, and so
Yeah.
pretty impressive. But
Thank you.
yeah, some ebooks, and then we also have a store with supplements that are curated specifically for certain either chronic diseases or for maintaining health. And they're all a lot of times we'll see products that have all of the things that have been tested, but as far as therapeutic dosing, it's not there. So we wanted to be sure we did a great job of making sure it was something that would actually promote wellness and health. So you can check
Right.
those out too. Yeah.
I got the link in the description box below for all my YouTube people. It's her link tree, so to take you to all of her links. Hey, I appreciate you for taking time for this. I wanted to make sure I introduce people to you and let them know it's geniuses out there that they can tap in with that's doing things holistically. And, best of luck to you in your practice. And I can't wait for our next talk.
All right. Sounds good. Thank you so much. And I hope you enjoy the rest of the day.
You too. Tell the family I said hi and I love them.
Will do. Same to you.
All right, later. Saturday, HJ? Yeah, we here. You could hit the leave button and I'll just close out the show.
All right.
All right. Let me see here. What y'all think, man? Huh? She knows her stuff. She was talking and she was saying stuff and I'm like, what the hell she just say? Shout out Kelson. Appreciate you, bruv. I tried not to get her in trouble. I didn't want to ask her too many questions to get her in trouble. Sometimes, the holistic doctors be disappearing. Somebody wave a magic wand and you don't see them. 9 lives. Appreciate you, bruv. It was a vibe. Matt Earth Theory. Hey. A little bit of Saturday grifting. We had this on the calendar. I'm going to try and bring you more of these conversations. I want to bring you the symposium, Black Health Symposium with Dr. Tanai Ricks and Minister Inky. And then we're going to add more professionals in as well. We got to get Rook back on the channel and talk to her about some of these things. And maybe we'll mash them all together. We'll get Micah, Rook, Tanai, and Inky. Matthew Aaron. We need more like her? Yeah, absolutely. I'm very proud of her. Start up her own practice and choosing an alternative way. Really, really exciting. Really exciting. We need more of this. Yeah. So yeah, we'll get more intelligent conversations. I'll probably line them up for Saturdays. We'll have our intelligent big brain conversations for Saturdays. I think that's the best time to do that. Oh, wow. Rook says she was literally 5 minutes from her office when she was at. Oh, wow. That's crazy. Y'all was right around the corner from each other. I got to link y'all. The invite ain't come through yet? I got to talk to DC. I got to talk to DC and what's going on. All of them in one space talking game will be revolutionary? Yeah. I think so too. When's the next debate? I don't know. The tough decision is figure out what's the debate. That's the tough decision. We got anime debates in line. We got Goldstein versus Martian. We got all types of stuff. But I'm gonna get out of here. Y'all should get out of here too. I appreciate everybody supporting the channel. Matthew Aaron, Matter of Theory, 9 Lives, Kelson. I don't want to make this stream too long because I want people to watch it. Sometimes when you get the long timestamps, people think, oh, this is too long for me to watch. So, I would say, it's very interesting. That last question I asked her, when is it a life? When is it a life, chat? When is it a life? I don't know. It's a tough question. 2 weeks, 4 weeks, 9 months, birth. I'd like people watching this on the replay, drop it in the comments. When do you think the life begins? I want to see the various answers we get just to show how complicated this question is. But in the comment section, tell us, when does life begin for a baby? I don't know. You at the Statue of Liberty, Jabari out there doing the family thing.
Oh, this a real Hotep brother.
Yeah, it's all good, Jabari. We got the replay here for you. No issues, no issues. Tell Dr. Inky about them long timestamps. Inky gonna go. Inky gonna go. I'm telling you right now, Inky gonna go. Him and Shaka. Could you imagine if I did a stream with Inky and Shaka? We would be here for 8 hours. Easily. Easily. Capital E, easily. Yeah, she did. She said fifth. I don't blame her. I don't blame her. Keep it professional. Keep it professional. All right. I'm out of here, man. Y'all be safe, man. Enjoy your weekend.
2, 1, boom. Hotep Jesus.
Of all the Jesuses I know, he's the Hotepiest. Social scientist and YouTube host, Hotep Jesus.
How the fuck do you get a name like Hotep Jesus?
The one and only Hotep Jesus.
Ryan Sharp, better known to the world as Hotep Jesus.
Hotep Jesus. Hotep Jesus. Hotep Jesus.
Hotep, you're a genius. HotepJesus.com.
Somebody said, what do you think you are? Some kind of Hotep Jesus?
Ooh,
And I
that's
was just
good.
like, ooh, that's sexy. Yes, I do think I'm Hotep Jesus.